What would you do right now if a loved one suddenly fell to the floor, unconscious and without a heartbeat? You'd probably remember to call 911 or your local emergency number. But what do you do until help arrives? The answer is begin CPR. Cardiovascular disease causes about 1 million deaths each year. And every year, about 300,000 to 400,000 Americans collapse in their homes, workplaces, and on the streets as a result of cardiac arrest. About 95% do not survive. You can make a difference by learning and using CPR. Cardiopulmonary resuscitation, or CPR, is a basic life support procedure performed on a person who suffers respiratory or cardiac arrest, resulting in sudden death. Sudden death is when breathing and the heart stop. Some examples of when this occurs are heart attack, near drowning, stroke, trauma, allergic reactions, electric shock, and suffocation. The first few minutes of sudden death are critical. If you are able to perform CPR until emergency medical assistance arrives, you can make the difference between life and death. During the next 30 minutes, we'll be demonstrating CPR and the Heimlich maneuver with real people and mannequins. CPR is as easy as ABC. Anyone can perform CPR or can give instructions to someone else. We'll show you how. If you come upon an unconscious person or someone collapses in front of you, kneel next to the shoulders. Tap or gently shake the person by the shoulder.
Jenny,
Shout, "Are you okay?" If they are unable to answer, call out for help.
Steve,
If help is available, have them call 911 for you. If you are alone, call 911 or your local emergency number now, before beginning CPR. Don't hang up. The operator will stay on the line and assist you until the emergency medical service arrives. After making your call, proceed with your evaluation of the unconscious person. If the victim is on their side or stomach, check for breathing. If they are not breathing, turn the person onto their back, supporting the head and neck. Open the airway using the head tilt, chin lift maneuver. If you suspect a head or spinal injury, try to open the airway by lifting the chin without tilting the head. Determine breathlessness by putting your ear about 1 inch over the mouth of the unconscious person. Feel and watch the chest for air movement. If the chest is rising and falling, the person is probably breathing. If the chest is not moving and you do not feel air from the mouth on your ear, you need to provide ventilations. To perform ventilations, first seal the nose by gently pinching it closed. Give 2 slow breaths, breathing in until the chest gently rises. The chest should rise with each breath. Allow the air to escape or the chest to fall between each breath. Check for a pulse. To check for a pulse, place 2 fingers on the Adam's apple and slide your fingers about 1/2 inch to 1 inch towards you. You'll feel a slight dip where you will find the pulse. Maintain the head tilt while you are checking for the pulse. If a pulse is present and the person is still not breathing, give 1 slow breath about every 5 seconds. Do this for about 1 minute or about 12 breaths. Recheck the pulse and breathing about every minute. Continue rescue breathing as long as a pulse is present, but the person is not breathing. If you don't feel a pulse, it's time to begin chest compressions. Find the notch where the lower ribs meet the breastbone. Place the heel of your hand on the breastbone next to your index finger. If you're having trouble finding where to place your hand, put the heel of your hand in the center of the chest between the 2 nipples. Place your other hand on top of the hand on the chest, interlocking your fingers. Keep your fingers straight. Lean over the person, keeping your arms straight, locking your elbows. Your shoulders should be above the person. Compress the chest by pressing straight down in a smooth, even rhythm. Each compression should take a little less than 1 second. If you count 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and so on, it will time your compressions for you. Give 15 compressions. This should take about 10 seconds, or a little more than 1 compression per second. Let the heel of your hands rest on the chest between compressions, keeping your elbows locked and your arms straight. Re-tilt the head, lift the chin, and give 2 slow breaths. Check the pulse at the end of the 4th set of compressions and breaths. If there is still no pulse, continue CPR. Check for a pulse every few minutes. If you find a pulse, check if the victim is breathing. If the victim is not breathing, give rescue breathing. If pulse and breathing are present, continue to monitor the victim's condition until the emergency team arrives. When the emergency team arrives, let them take over. A child is considered age 1 through 8. For a child over the age of 8, follow adult CPR instruction. These are only guidelines. If you have a large child under the age of 8, the size of an adult, use the adult guidelines. Let your judgment be your best guide. CPR for a child is almost identical to adult CPR except for a few changes. With a child, you call 911 or your local emergency number after 1 minute of CPR. You need to start CPR as soon as possible after the child's heart stops beating. When the brain cells don't get oxygen, they begin to die after only 4 minutes. Starting CPR immediately will increase the child's chance of survival. If you are not alone, you can have someone else call 911 while you begin CPR. The ratio of breaths to compressions is 1 to 5, and you use the heel of one hand. Okay, let's do it.
Ryan,
Establish
you okay?
unresponsiveness.
Ryan.
If others are present, have someone call the local emergency number for you. Look, listen, and feel. Determine breathlessness by putting your ear over the mouth of the unconscious child. Feel and listen for air movement. Watch the chest for air movement. If the chest is not moving and you do not feel or hear air from the mouth, you need to provide ventilations. Open the airway by tilting the head back and pinch the nose shut. If you suspect a head or spinal injury, try to open the airway by lifting the chin without tilting the head. Give 2 slow breaths. Watch the chest gently rise and allow the chest to fall. Check for a pulse. If the pulse is absent, begin CPR. Place the child on its back on a firm, level surface. Kneel beside the child's shoulders. Keep the child's head tilted back with one hand. Find your hand position on the lower half of the breastbone, or about 1 finger below the imaginary nipple line. You can find the breastbone by feeling where the ribs meet. Give 5 chest compressions. 5 compressions should take about 3 seconds. Count 1 and 2 and 3 and 4 and 5. Then 1 slow breath. Remember, the ratio is 1 to 5 in a child. That's 1 slow breath to 5 chest compressions. After about 1 minute of breaths and compressions, check for a pulse. If you are alone, stop CPR and call your local emergency number now. Check for breathing and pulse again. If the child is not breathing and the pulse is not present, resume CPR until help arrives. Check for breathing and pulse every 2 to 3 minutes. If breathing is absent but the pulse is present, provide a breath about every 3 seconds. Count 1, 2, 3, breathe, 1, 2, 3, breathe, and so on. Check for a pulse about every minute. If you are alone, remember to call your local emergency number or 911 after 1 minute of rescue breathing. Establish unresponsiveness. Check breathing. Look, listen, and feel. If the infant is not breathing, open the airway with the head tilt chin lift. Check for obstructions. Sweep the mouth only if you see an object. Give 2 slow, gentle breaths over the mouth and nose. Just enough air for the chest to rise. Each breath should last about 1 1/2 seconds. Allow the air to escape and the chest to fall between each breath. Check the brachial pulse, which is located on the inside of the upper arm between the elbow and the shoulder. Check for about 5 seconds. If breathing is absent but pulse is present, provide rescue breathing, 1 breath every 3 seconds. Remember, breaths on an infant should cover the infant's mouth and nose. 1, 2, 3, breathe. 1, 2, 3, breathe, and so on. If you cannot feel a pulse, begin chest compressions. Place the infant on its back on a firm surface like a table or floor. The hard surface can also be your hand or forearm, with your palm supporting the infant's back. Chest compressions on an infant are done with 2 fingers instead of the heel of the hand. Use the index and middle finger and place them mid-nipple line or mid-breastbone, whichever way is easier for you to find placement. Give 5 chest compressions followed by 1 breath. The 5 compressions should take about 3 seconds. Continue the ratio of 1 to 5, 1 slow breath to 5 chest compressions. After about 1 minute of CPR, check the pulse. Now you call 911. After calling 911, resume CPR. Recheck breathing and pulse every 2 to 3 minutes. If breathing is present, stop ventilations. If breathing and pulse are both present, stop CPR and observe the baby carefully until the emergency medical services arrive. Otherwise, continue to do CPR until help arrives, even though there appears to be no change in responsiveness. If any victim, adult, child, or infant, vomits while you are giving CPR, turn them onto one side and wipe the mouth clean. Use a protective barrier such as a glove or handkerchief if a commercial barrier is not available. Then roll the victim onto their back and continue CPR. When performing chest compressions, you may hear a pop or crunching sound. This sound is not unusual, and CPR should not be interrupted or stopped. Do not practice actual compressions on a real person unless that person does not have a pulse. You may imitate or pretend to do compressions while practicing CPR on a pillow, doll, or mannequin. Just do your best. A person that isn't breathing and is without a pulse can only benefit from your efforts. Choking is a common breathing emergency. Choking is caused by food or an object blocking the airway. A choking child or an adult can quickly stop breathing, lose consciousness, and die. It is important to recognize when first aid is needed. If a person is choking and is coughing forcefully, leave them alone and let them try to cough out the object on their own. A person that is getting enough air to cough is getting enough air to breathe. Stay with the person and encourage him or her to continue coughing. This is a partially obstructed airway. If the person continues to cough without coughing out the object, call for emergency assistance. A partial obstruction can become a complete obstruction very quickly. A person whose airway is completely blocked cannot speak, cough, or breathe. You may hear a weak cough or a high-pitched noise. This means that the person isn't getting enough air to stay alive, and you must give first aid immediately. Ask if you can help. If others are around, ask someone to call for an ambulance or 911 while you assist the choking person. You'll try to remove the object that is blocking the airway by giving abdominal thrusts. This is called the Heimlich maneuver.
Can I help?
Stand behind the victim. Wrap your arms around the waist. Make a fist with one hand and place the thumb side against the middle of the victim's abdomen, just above the navel, but below the rib cage. Grab your fist with your other hand and give quick inward and upward abdominal thrusts until the airway is cleared. Repeat the thrusts until effective or the victim becomes unconscious. Use your leg to lower him or her to the ground. Don't do abdominal thrusts if the victim is pregnant. If the choking victim is pregnant or too big to reach around, give chest thrusts instead of abdominal thrusts. Chest thrusts are like the abdominal thrusts except for the hand placement. Place your fist against the center of the victim's breastbone. Grab your fist with your other hand and give quick thrusts into the chest. If you suspect a head or spinal injury, try to open the airway by lifting the chin without tilting the head. If the victim is unconscious, perform a tongue-jaw lift followed by a finger sweep to remove the object from the mouth. Do this by bending the index finger and sweeping through the open mouth. In a child, do a sweep only if you see the obstruction. Open the airway and try to ventilate. If still obstructed, reposition the head and try to ventilate again. The airway can become blocked by such things as the tongue falling back in the throat, an object such as a coin or food, and sometimes repositioning the head will open the airway. If still obstructed, straddle one or both of the victim's legs. Place the heel of one hand on the middle of the abdomen just above the navel. Place the other hand on top of the first. Point the fingers of both hands directly toward the victim's head. Give quick thrusts toward the head and into the abdomen. After giving 5 thrusts, do a finger sweep and try to hook the object out, being careful not to push it further down. Reattempt your 2 slow breaths. If you still can't get air into the victim, repeat the 5 thrusts, finger sweeps on the adult, and breaths. Repeat this sequence until the victim is unobstructed or until help arrives. The victim should be taken to the hospital emergency department to be checked by a physician. This should be done even if the person is breathing well. Choking is a major cause of death and injury in infants. Infants learn about the world around them by putting objects in their mouth. Like a child who is choking, a choking infant can quickly stop breathing, lose consciousness, and die. If the infant is coughing forcefully, allow the infant to continue to cough. Watch the infant carefully. If the infant does not stop coughing in a few minutes, or if the infant coughs weakly, makes a high-pitched sound while coughing, or cannot cry, cough, or breathe, you'll need to provide rescue breathing. If you are not alone, have someone else call 911 or the local emergency number for you. To clear a blocked airway, you will need to give back blows and chest thrusts. Position the infant face down on your arm, with your hand supporting the infant's head. The head of the infant should be lower than its chest. With the heel of your other hand, palm open, strike the infant between the shoulder blades. Reposition the infant, sandwiching it between your 2 arms, and roll the infant over. Place 2 or 3 fingers in the center of the breastbone or mid-nipple line and give 5 chest thrusts. Each thrust should be about 1 inch deep. Turn the infant face down again and repeat back blows, followed by chest thrusts. Make sure the head is lower than the rest of the body and the head is supported by holding the jaw firmly. Deliver up to 5 chest thrusts. Use the tip of 2 fingers for the thrusts. The thrust position is the same as infant CPR, mid-nipple line. The thrusts are downward and quick. Stop as soon as the object is coughed up or the infant starts to breathe or cough. Call the local emergency number if you have not already done so. The infant should be taken to the hospital emergency department to be checked by a doctor. Do this even if the infant seems to be breathing normally. You should not perform CPR on a real person unless that person has stopped breathing and does not have a heartbeat. It could cause serious injury. This video is a tool to show you how you can use CPR in a life-threatening situation. These are guidelines. If you do 10 compressions instead of 12, that's okay. Don't start over if you lose count. It's just not that important. Special mouth-to-mouth barrier devices are available to protect you from oral secretions or communicable diseases. In some states, these are mandatory, but are recommended at all times, everywhere. The more you view this tape, the more you'll know what to do in a real life-threatening situation. We encourage you to practice and to review this tape often to remain familiar with these techniques. Hopefully, you'll never need to use them, but if you do, you'll feel better knowing you're prepared and can offer someone life-saving assistance. Please contact your local fire department, the American Red Cross, or the American Heart Association for individual instruction and certification.
Mom! Mom, are you okay?
Operator, how can we help you?
I need help. My mom's on the floor and she's not breathing.
You know CPR?
Yes, I do.
Start CPR.
Okay. One and two and three and four and five and six and seven and eight and nine and 10 and 11 and 12 and 13 and 14 and 15. One and two and three and four and five and six and seven and eight and nine and 10 and 11 and 12 and 13 and 14 and 15.
Fire department.
6 and 7 and 8 and 9 and 10 and 11
Good job.
and
Good
12
CPR.
and 13 and 14
We'll go ahead and take
15.
over now.
Now, please come to the primary corridor. Passenger service counter remains.
Sir, are you all right?
Southend
Are you all right?
Hotel. Please come to the primary corridor.
Call the fire department. We'll need an ambulance.
You have just witnessed a cardiac arrest in an environment involving people with different origins, races, cultures, and lifestyles. The rescuer who administered cardiopulmonary resuscitation, CPR, did not waste a moment to the thought of contracting a communicable disease and becoming a potential victim of that disease because he was equipped with the CPR microshield. It was developed as a first response protective device which is used during human resuscitation and which can also be used with a mannequin in CPR training. The CPR microshield provides a physical barrier between victim and rescuer, diminishing the risk potential for disease transmission by reducing the amount of actual contact with the victim's mucosal surfaces and body secretions. The CPR microshield conforms with the new guidelines issued by the American Red Cross and the American Heart Association, suggesting the possible use of a face shield during CPR. It allows for single rescuer resuscitation without alteration of the learned resuscitation technique. The rescuer is able to stay at the victim's side perpendicular to the victim, as opposed to being parallel and at the head end of the victim, as is required with most other devices. The CPR microshield utilizes a one-way valve which allows air to pass from the rescuer to the victim, but does not allow the victim's exhaled air or secretions to come in contact with the rescuer. The CPR microshield incorporates the use of a firm housing for the one-way valve, which also serves as a bite block, allowing the rescuer to maintain an upward pressure on the chin of the victim without closing the victim's mouth. This makes it easier to sustain an open airway when using the recommended head tilt, chin lift maneuver. The barrier membrane is made of ultra-soft vinyl that conforms to the victim's facial contours, thus allowing for an airtight seal. It is not a cumbersome preformed mask. Embedded into the barrier membrane are specially designed ribs, which allow for the victim's exhaled air to be directed away from the rescuer. Another advantage of the CPR microshield lies in its simplicity. It is a single unit with no required accessories, extra parts to assemble, or straps to tangle. Because it is made of flexible vinyl, it is not size specific, and it is considered a universal, one-size-fits-all device. The CPR microshield comes packaged in its own highly visible, lightweight pouch, which is easily stored or carried in pocket or purse. The CPR microshield is a first response protective device for use by individuals trained in the techniques of CPR and for use in cardiopulmonary resuscitation training. It is intended for single use and is fully disposable. The device is delivered surgically clean and comes complete with instructions for use.